Bones of the upper limb. There are 30 bones in each upper limb. The humerus is the single bone of the upper arm, and the ulna and radius are the paired bones of the forearm. The base of the hand contains 8 bones called the carpal bones, and the palm of the hand is formed by 5 bones called the metacarpal bones. The fingers and thumb contain a total of 14 bones, each of which is a phalanx bone of the hand. The humerus is the single bone of the upper arm region. At its proximal end is the head of the humerus. The head articulates with the glenoid cavity of the scapula to form the glenohumeral joint. The margin of smooth area of the head is the anatomical neck of the humerus. Located on the lateral side of the proximal humerus is an expanded bony area called the greater tubercle. The smaller, lesser tubercle of the humerus is found on the anterior aspect of the humerus. Both the greater and lesser tubercles serve as attachment sites for muscles that act across the shoulder. Passing between the greater and lesser tubercles is the narrow intertubercular groove, or sulcus, which is also known as the bicipital groove, because it provides passage for a tendon of the biceps brachii muscle. The surgical neck is located at the base of the expanded proximal end of the humerus, where it joins with the narrow shaft of the humerus. The surgical neck is a common site of arm fractures. The deltoid tuberosity is a roughened V-shaped region located on the lateral side in the middle of the humeral shaft. As its name indicates, it is the site of attachment for the deltoid muscle. Distally, the humerus becomes flattened. The prominent bony projection on the medial side is the medial epicondyle of the humerus. The much smaller lateral epicondyle of the humerus is found on the lateral distal side. The roughened ridge of the bone above the lateral epicondyle is the lateral supracondylar ridge. All of these areas are attachment points for muscles that act on the forearm, wrist, and hand. The powerful grasping muscles of the anterior forearm arise from the medial epicondyle, which is thus larger and more robust than the lateral epicondyle. That gives rise to the weaker posterior forearm muscles. The distal end of the humerus has 2 articulation areas, which join the ulna and radius bones of the forearm to form the elbow joint. The more medial of these areas is called the trochlea. The trochlea articulates with the ulna bone. Immediately lateral to the trochlea is the capitulum, which is a knob-like structure located on the anterior surface of the distal humerus. The capitulum articulates with the radius of the forearm. Just above these bony areas are 2 small depressions. These spaces accommodate the forearm bones when the elbow is fully bent or flexed. Superior to the trochlea is the coronoid fossa, which receives the coronoid process of the ulna, and above the capitulum is the radial fossa, which receives the head of the radius when the elbow is flexed. Similarly, the posterior humerus has the olecranon fossa, which is a larger depression that receives the olecranon process of the ulna when the arm is fully extended. The ulna is the medial bone of the forearm. The proximal end of the ulna resembles a crescent shape with the C-shaped trochlear notch. This region articulates with the trochlea of the humerus as part of the elbow joint. The inferior margin of the trochlear notch is formed by a prominent lip of bone called the coronoid process of the ulna. Just below this is a roughened area called the ulnar tuberosity. To the lateral side is a small smooth area called the radial notch of the ulna. This area is the site of articulation between the proximal radius and the ulna, forming the proximal radial ulnar joint. The posterior and superior portions of the proximal ulna make up the olecranon process, which forms the bony tip of the elbow. More distal is the shaft of the ulna. The lateral side of the shaft forms a ridge called the interosseous border of the ulna. This is the line of attachment for the interosseous membrane of the forearm. The interosseous membrane of the forearm is a sheet of dense connective tissue that unites the ulna and radius bones. The small rounded area that forms the distal end is the head of the ulna. Projecting from the posterior side of the ulnar head is the styloid process of the ulna, which is a short bony projection. This serves as an attachment point for a connective tissue structure that unites the distal ends of the ulna and radius. In the anatomical position, with the elbow fully extended and the palms facing forward, the arm and forearm do not form a straight line. Instead, the forearm deviates laterally by about 5 to 15 degrees from the line of the arm. This deviation is called the carrying angle. The carrying angle allows the forearm and hand to swing freely or to carry an object without hitting the hip. The carrying angle is larger in females to accommodate the wider pelvis. The radius runs parallel to the ulna on the lateral side of the forearm. The head of the radius is a disc-shaped structure that forms the proximal end. The small depression on the surface of the head articulates with the capitulum of the humerus as part of the elbow joint, whereas the smooth outer margin of the head articulates with the radial notch of the ulna at the proximal radial-ulnar joint. The neck of the radius is a narrowed region immediately below the expanded head. Inferior to this point, on the medial side, is the radial tuberosity, which is an oval-shaped bony protuberance that serves as muscle attachment points. The shaft of the radius is slightly curved and has a small ridge along its medial side. This ridge forms the interosseous border of the radius, which is the line of attachment for the interosseous membrane that unites the two forearm bones. The distal end of the radius has a smooth surface for articulation with two carpal bones to form the radiocarpal joint. On the medial side of the distal radius is the ulnar notch of the radius. This shallow depression articulates with the head of the ulna, which together form the distal radio-ulnar joint. The lateral end of the radius has a pointed projection called the styloid process of the radius. This provides attachment for ligaments that support the lateral side of the wrist joint. Compared to the styloid process of the ulna, the styloid process of the radius projects more distally, thereby limiting the range of movement for lateral deviations of the hand at the wrist joint. Thank you for watching.